first thing you want to do is let the person know what you're going to be doing. So Agnes, today we're going to be doing some range of motion with your arms and legs. And if anything bothers you as we go along, you let me know, okay?
Okay.
Another thing that I'm doing is making sure that I have room to move around so it's safe. Clear things from the floor so I'm not tripping on them, and I have easy access and I'm able to move to the lower extremities and to the upper extremities with the resident here. As far as patient positioning, these are key components here. What you want to do is make sure they're slid up in bed far enough so their feet aren't resting on the foot plate so you can get full range of motion extension of the lower extremities. Also, many times people will sleep with 2 or 3 pillows. It's important to get the full benefits of range of motion by taking away as many pillows as possible to get them as flat as possible so they aren't in this flexed posture all the time. You want to get them into as much extension as possible. All right, so what I did, I removed 2 pillows, and we have one here under Agnes's shoulder and neck. And as we go through the range of motion, I'll continue to try to stretch her into extension to increase and improve her posture. Another key component besides just the patient or resident safety is your safety. What do I mean by this? I mean your body mechanics. It's important to raise the bed to a level that is appropriate for you. So I'm not reaching way up here to do range of motion, or I'm not stooped over to do range of motion, but she's at a good level for me right now. I can make up that difference by moving the bed up and down or by bending my knees and moving up and down as so. With your body mechanics, with doing these things, you always want a slight curve in your low back. You don't want to severely arch it, and you don't want to round. So just a light curve in the low back, and you use your legs to move your side to side. You don't pivot like so on your spine. That's the worst motion you can do. So your safety as well as the resident safety are key when you're doing the range of motion. I also removed a bunch of pillows and things that were in the way to kind of clear the area. Depending on what the resident is wearing, you also have to be sure that you're properly draping throughout to preserve patient modesty as well. What I'm going to start with here is a range of motion of the left upper extremity, and then we'll move into the lower extremity. Basic guidelines for range of motion are to go to the point of a gentle stretch. Now, it's okay to be somewhat aggressive, but you don't want to be dangerous with it. So you want to check out ahead of time if perhaps our resident here had some sort of a fracture in the shoulder. I would probably not work with the shoulder so much. If there's a hip fracture, you certainly want to avoid a lot of the movements. So you need to check out ahead of time exactly what's going on with the resident or patient that you're working with. To start with the upper extremity, we're going to start with the shoulder, and your positioning with your hands as well helps to facilitate this. So you want to take a hold near the wrist area if you're not creating any pain. Now you let me know if there's any discomfort when we do this.
Okay.
Okay? And I'm going to take her just to the point of gentle stretch. Right there. And I could see that she moved. She gave me a little head nod as well. And I bring it back down. Slow and controlled movements. I'm stabilizing a little bit here in the, if I just grabbed on the distal end of the arm, I don't have as much control, but I'm helping here by grabbing closer to her shoulder joint itself. We're going to go up. And I feel a little stretch there too. And I'm also kind of reading her eyes a little bit and see where she's getting a little stretch right there. So I'm being somewhat aggressive, but I'm stopping at that point of gentle stretch. 4 and 5. This is shoulder flexion. And I would do 10 repetitions with that. Now we're going to move into shoulder abduction. For this one, you come underneath the upper arm again, and I still have a hold out at the wrist. You always want to take the thumb and point it towards the ceiling, or towards the head, excuse me. Okay? So as I go out, right there we're getting a little stretch, correct?
Yeah.
All right, good. And back down. And I have to be careful here that the pillow doesn't get in the way and prevent me from going to the full range of motion. So you need to watch the pillow. If for some reason the pillow is in the way, I would just stop for a moment and move the pillow over. It's important to be effective with these and also increase your efficiency just by positioning of pillows and your position. Good right there. That's a little far maybe. We'll back off. Better? Relax your arm. Let me take it. And I'll do one more here. And that's shoulder abduction. From there, we want to go with shoulder internal and external rotation. Internal rotation is rotating the hand towards the midline of the body. External is rotating it away. And you can do this in any position. You can start from here and do it, but that's not very functional. We don't do many movements right from here. So I tend to abduct the arm a bit to about 70 degrees and work internal and external rotation from here. As you see, we've got full range of motion internally. Externally, she stops at about 20 degrees or so. A little bit of limitations there. You okay? 4 and 5. Good. We're going to move from the basic shoulder movements into the elbow. And with the elbow, I like to curl it so the palm is facing the upper arm. So as we move up here, ooh, that's far enough, and extend out. She has a tender elbow today.
Very.
Try to relax it a little bit, okay? Let me do the motion for you. A little better? Oftentimes, if you can get your resident to relax their muscles, you can do the movement for them, and they don't. You'll actually have an increased range of motion. Notice the flexion. We stop about there. Elbow extension. She's lacking probably 25, 30 degrees, but she does have a sore elbow. And I'm just getting a little stretch there. I don't want to go much further. Okay, good. From the elbow, I'm going to move to the wrist. You can do this in any position. You can move the hand here. You can straighten it out. We want to do wrist extension and flexion. You okay with that? Mm-hmm. Important to keep the wrist moving as it assists with feeding and self-cares. Okay, and from there I'm going to work the forearm. Supination and pronation. Supination is taking the underside of the arm here and rotating it towards the head. So it's just like so. So we have supination and pronation. Be very careful with this one that when you get to the point of stretch, you don't torque past there any further. You could end up with fractures. Okay, so it's just a gentle stretch back and forth with the arm. And you can do it out here as well. Okay, we're just rotating palm up, palm down. Good. That's another important area to keep the range of motion involved with. If you think of someone that needs to move your fork to the mouth to feed or brush your teeth, if you aren't able to flip this way with your arm, you aren't going to be able to do that effectively.